Hello! In today's lesson, we're looking into the question, what are the different types of drugs and how do they affect our bodies? My name is Mr. Watts, this is What's Your Question? Let's go! My objectives for you in today's lesson then are to name the different kinds of drugs, to describe the effects of each of the different kinds of drugs, and explain the risks of the different drugs. We're going to go through each of the different types of drug, in turn explain some examples of each, and explain exactly what effects they have on your body, and then we'll look at specific examples of those and the effects and dangers of those also. Okay, there are two main types of drug to start off with. Before we categorise them into their effects, we generally categorise them into their medicinal or recreational usage. We can also split them into illegal or legal in each of these sections as well, as there are legal versions of each and illegal versions of each. So when it comes to recreational drugs, you're looking at things like alcohol, which people drink to have fun and enjoy themselves, and in some cases parties and things like that. And we also have things like smoking and cigarettes and caffeine. When it comes to recreational drugs, when it comes to medicinal drugs, you're looking at things like paracetamol, ibuprofen, and other things along those lines. So it depends on the use of these as to how we categorise them. In terms of legal versions, the caffeine, the alcohol is all legal, the paracetamol, the ibuprofen is legal. In terms of illegal versions, recreational, we can have things like cocaine, cannabis, and for medicinal, illegal drugs, we can have things like morphine, which you can't use outside of hospitals legally. You're not allowed to have your own version of it and use it yourself. We have laughing gas, which people use in hospitals as a sedative, but then is used recreationally outside of hospitals as well. And also cannabis can be used illegally as a treatment for certain illnesses. If we're categorising the drugs by their effects, there are four main types of drug that you need to be able to talk about. There are painkillers, which the name kind of gives away. There are stimulants, which speed your body up. There are depressants, which sort of slow your body down, and there are hallucinogens, which can cause you to hallucinate. We are going to look at some other examples at another time, but not in this video. So there's the four main ones you need to know about key stage 3. Painkillers are a really useful drug that we use on a regular basis in a medicinal setting, and you're also allowed to use these self-prescribed in a couple of examples as well. You'll all know that paracetamol is used to treat pain, and ibuprofen can also be used to treat that as well. You also know that morphine is used in hospitals to treat pain also. These are all legal drugs. Morphine only in hospitals if you are given the right dosage, or it can be prescribed in some cases as well. We can get illegal versions of painkillers as well, and heroin is a good example of an illegal painkiller. Its chemical name is 3,6-diacetylmorphine, so it's actually a sort of type of morphine as well, so it's similar to that morphine we use. The difference here is that heroin is significantly more addictive, and that's why it also has its illegal properties, or its illegal status. The effects of this are generally to block the pain receptors in the body, and those stronger ones cause a rush of pleasure and put you in a drowsy state as well. And that rush of pleasure, that high that people get from taking it, is the reason why they get so addicted. Because when taking heroin, the idea is they get such a big high and such a quick high that they then get addicted to getting that feeling. It then, as they take more of the heroin, takes more and more of that drug to cause that same level of high. So the more they use, the more they've got to use, the more expensive it becomes, and the less money they then have for other things. And this is how it leads. Heroin addiction can lead to people being homeless and scrounging on the streets and trying to do everything they can to get hold of their next fix. Next, we're going to talk about stimulants. Legal examples of stimulants are things like caffeine, which people can come across in energy drinks, Coke, tea, and coffee. These are all legal ways to access it, and it just stimulates your body. We'll talk about that more in a second. Illegal versions of this are cocaine, which have significantly more serious effects than the caffeine and Coke does, but the effects are similar, just slightly more dangerous in the cocaine. The effects of this, we're going to make them more energetic, more talkative, more active, more alert, and more excited. It generally makes you run quicker, your heart will beat quicker, it will speed up your body processes, and you will move at a much quicker rate. Overuse of this and high doses of this can lead to people having paranoia and can result in a disease called schizophrenia, which is a mental disorder which affects certain people. Hallucinogens is the next one we're going to talk about. LSD is the main example of hallucinogens we're going to talk about here. It's a illegal recreational drug. You're not allowed to use it, but people do manage to get hold of it. And it can also, in some cases, after lots of research, they found that it can be used to treat depression. The effects of this drug, it makes you feel detached to your surroundings, and this is because you'll end up hallucinating. You end up seeing things that aren't really there. It can make you have mood swings and alter your sense of space and time. People often, when they take it, seem to have feelings of insight, so they think they know things that people don't, or realise things that nobody else has realised. And also, in some cases, because it plays on what you think about, it can also cause people to have religious experiences where they think they're spoken to people of higher order beings like gods or Jesus or people along those lines. The final of the 4 different drugs we're going to look at today is depressants. Now, depressants are the opposite of stimulants, and some examples of this are things like alcohol, which is a legal version of a depressant, and some illegal versions of this would be things like cannabis, ketamine, and GHB or gamma hydroxybutyrate, which is also called a date rape drug, which is a particularly nice one. Any tranquilizers will fit into this category. The effects of these drugs is generally the opposite of those effects we talked about when it came to stimulants. So instead of increasing our heart rate and making everything go quicker, they're going to slow things down, they're going to relax people, chill them out, and make them more mellow. There is the possibility, though, of these not being the case, and you can end up with certain effects like extra levels of anxiety, nightmares, and aggression. And the most common version of this is when it comes to cannabis. People who take this often end up with anxiety, even though they end up taking it. They start using it in order to treat their anxiety, to make themselves feel better. They claim it calms them down, but actually research has shown that it can make their anxiety worse. The first of the drugs I'm going to talk about in specific detail is cocaine, which I've placed a picture of here. Cocaine is generally used by people who work in high-powered jobs, or generally people who go out partying, who are trying to stay up later, try to do more, and try to keep awake without needing as much sleep. It means that their body stays awake, and as long as they keep taking it, they'll have the energy to do the things that they need to do. This puts a lot of unnecessary strain on the heart and the muscles in our body, because our body needs to have rest, and particularly our brain, without sleep, can have serious negative effects on our mental health. It's very, very addictive, and overuse, if you have a heart condition, can lead to it being fatal, because your heart's going to have to work significantly harder, it's going to get less rest, you're not going to get that sleep. It can lead to you having a heart attack and dying if you take too much too regularly. If you do end up addicted to these drugs, you have to go through something called withdrawal. When you're addicted, your body is desperate to get hold of more of this drug, and withdrawal is when you stop taking it, and your body then will desperately try to make you get hold of more of it. You'll crave that thing more and more and more each time, every day, as long as you leave it and don't take that drug. There's lots of stages to this, and it gets worse as time goes on. Probably the most common illegal drug that people know about is cannabis or weed. Cannabis is a depressant, as we've said before, and people smoke it to calm themselves down at parties and in groups. Often it's taken alone as well. And people have to grow it people often grow it in their homes and in broken buildings, or not broken, closed down buildings to grow and sell. It is completely illegal, and people are not allowed to sell it. The effect of this, we talked about, as depressants, are going to slow you down, calm you down, and probably make you just feel much calmer in general. But also, it can cause you to wheeze and be out of breath, because when you're taking it, you are smoking the cannabis, so it can have similar effects to that smoking. It can make you cough uncontrollably, just like smoking would. It can affect your respiratory system. If you have asthma, it can make that significantly worse. It can make anxiety worse. It can cause depression, and it can impair your memory and make it more difficult for you to remember things. It has recently, in certain research, been found that parts of this have been found useful to treat certain diseases, but other parts of the cannabis, other chemicals inside of it, are equally as bad. And when treatment's being done, they are extracting specific chemicals from the cannabis to treat those diseases. They are not, in most cases, just giving out cannabis for people to smoke. In certain countries, they do that. In several states in America, cannabis is a legal drug. You're allowed to go and buy it to treat certain diseases. It also works quite as a bit of a painkiller as well, and that's why people use this one. One of the legal drugs we need to talk about here is cigarettes. Some pictures of them here, just because we can. Cigarettes contain thousands of different drugs, including things like rat poison, for various other things. But the main 4 you need to be able to know about are tar, which can be found in these. When you smoke that tar will get into your lungs and block up your alveoli, so you can't do as much gas exchange. It also contains nicotine, which is our stimulant drug, which is the addictive part of cigarettes. Once you've started smoking these, that nicotine is what makes you want to go back and get more of the cigarettes. And finally, they also, when you're smoking them, cause you to breathe in carbon monoxide. Carbon monoxide replaces the oxygen in your red blood cells. So when you breathe in normally, your oxygen attaches to hemoglobin in your blood, but when you breathe in carbon monoxide takes up some of that space. So as long as you're breathing in carbon monoxide, you are not going to be able to get as much oxygen, so you are going to have less respiration able to happen in your body, and so you're not going to be able to produce as much energy as you normally would. Now, there are lots of negative effects to this drug because it's obviously going to make asthma worse that you've got in your body. It also increases your likelihood of getting lung cancer. And the really important part about this is that if you're near to somebody who's smoking, we have a thing called passive smoking, where even being near to them and breathing in the smoke given off by them can have similar effects to actually smoking. So if you live with someone that smokes, you're breathing all those things in, and the effect is going to be exactly the same. If you smoke while you're pregnant, it makes you significantly more likely to have a miscarriage, and if you don't have a miscarriage, it's more likely your baby will be smaller and less developed. You are then putting your baby at risk if you're smoking whilst you are pregnant. So you shouldn't be doing. Probably the most common legal drug that we know about is alcohol, and people drink this on a regular basis. People drink it in very, very large amounts. Now, drinking this in excessive amounts is called binge drinking, and if you're drinking more than sort of 14 units on a regular basis, like every single week, you're drinking too much alcohol, and this can start to have negative effects on your body. Alcohol generally tends to enhance whatever mood you are currently in. So if you're in a great mood, you'll feel great. If you're in a bad mood, it will make you feel worse. It's very easy to become addicted to this. And if you drink too much of it, it can cause stomach problems and eventually lead to something called cirrhosis of the liver, where your liver starts to die. If you are doing this, you'll need to get a liver transplant to make yourself better, and this would mean stopping drinking completely and proving that you can stop drinking and keep that up for extended periods of time, because they're not going to give you someone else's liver if you can't show that you're going to look after it. If you're pregnant and you're drinking, again, just like smoking, it can cause you to have a miscarriage. It can cause you to have a stillbirth, it can cause you to have a premature baby, and have serious negative effects on that baby. And babies who do, and parents who do drink whilst they are pregnant, in a lot of cases end up having a child with something called fetal alcohol syndrome. This means there is a few different markers about that person that you can tell that the parent has drunk alcohol whilst they were pregnant with the child. It's facial features that generally show this to be the case. It can make men less fertile, so if people are trying for a baby, they shouldn't be drinking alcohol, and that's all you need to know about alcohol, really. If you do have any questions about any of these drugs, throw them in the comments, and I'm happy to answer those questions at any point. Thanks very much for watching. Make sure you stay safe, stay alert, stay curious, and subscribe.